Hello, everyone. Thank you for joining us this evening. We are about to start our program, Navigating Pregnancy During a Pandemic. We have two amazing panelists with us this evening. So I'm just waiting for a few people to trickle in. Thank you for joining. If you do have any questions, you can drop it in the chat. We will be fielding questions from professionals, and they will definitely give us some guidance on this very important topic. I'm excited to be here this evening, and I was honored to accept the moderator role this evening. So I'm very, very excited, and I hope that tonight's conversation goes really well. This is part 2. The first time we definitely, went over 2 hours, and it was a really, really good time amidst women and men. So I'm excited to be doing this again. So without further ado, I will add our moderators, our panelists, sorry. Hello, ladies. How are you?
Hello.
Good evening.
Awesome. So we are about to start. I just wanted to bring you guys on while we started tonight's event, and I'm just going to do some introductions. So again, welcome to Navigating Pregnancy During a Pandemic. First, we want to say thank you to our sponsors, Lyft and DoorDash, for this part 2 episode today. And thank you both, Thamar and Nerline, for being our panelists and for agreeing to be a part of this very important conversation this evening. So it was so good and informative a few weeks ago that we are back for a part 2. Last time we were together, we spoke about a myriad of topics like preeclampsia, how to prepare for pregnancy, finding the right provider, prenatal massages, postpartum, adding your partner to the conversation, and a bunch of other things. So we are looking forward to having more of this conversation this evening. So before we go into our program, just want to do some more housekeeping. So HAC, Haitian American Caucus, they are actually looking for more people to join this nonprofit organization to help do more work like this and a bunch of other things across the globe. So if you sign up today, you will be entered to win a free meal on DoorDash or a free Lyft ride. So you can go to hackglobal.org/join. So hacglobal.org/join. If you are an expecting mother or nursing mother, and you will be eligible to get these free incentives if you sign up before midnight tonight. Now, I know some of us got those DoorDash codes and those Lyft codes, so we were enjoying it for the month of November. So we are back again with the same offers from our amazing sponsors, Lyft and DoorDash, sorry. Okay, again, we got some people that trickled in. Welcome to Navigating Pregnancy During a Pandemic. I am going to read the bios of our panelists this evening. So Thamar Innocent is a certified health coach and full spectrum doula. Her passion is deeply rooted in her Haitian culture, which prides itself on caring for women from preconception through their transition into motherhood. She feels that her purpose is to support and empower women to lead a holistic lifestyle. Her goal is to always create a space filled with support, resources, advocacy, love, and a listening ear. She received her BS in Health Services Administration in New York City and lives in Brooklyn, New York with her family. Thamar, thank you so much for being with us this evening. Our next panelist is Nerline St. Elme. She's a registered nurse. Nerline St. Elme works as the Director of Patient Services at Concerned Home Managers for the Elderly in New York City. Nerline has 10 years of nursing experience and over 7 years of experience as a community health nurse. She has supervised and overseen patient care in community health centers, home health care, and other community health settings. One of her favorite aspects of her work is caring for young women. She provides women with information about their health and well-being, which allows them to make informed decisions that can positively impact other areas of their lives. Nerline, thank you so much for coming back and being a part of this conversation. All right, so I'm excited to be the moderator this evening. My name is Debbie Lewis, and I'm a strategist and event planner. And why I'm excited to be a part of this conversation is because I have recently fell into loving the conversation on pregnancy and post-pregnancy. So I've experienced complications and tough conversations with my providers. And being a Caribbean American, my family often views being pregnant as a blessing, for sure, but everything is on pause because you're sick. So for the first 5 years of a child's life as well, everything is on pause. You have to put everything on hold because you have a baby. So shout out to my Haitian mother who ingrained that in my head. I love her. So let's start the conversation off with where we left off last time. But first, talking about an experience that the three of us had this week together. On Monday, we all chimed into a hearing, which solidified a lot of what we spoke about the last time we were together. Just shake your heads if I'm right. So we chimed into this conversation together, and this hearing was held by City Council of New York City. And our fearless leader, Thamar, testified at this hearing, and they have admitted to either being or having a bias in the hospital systems and a process of providing services to people of color. So there were many questions that were asked, like how many Black women have had maternal death or have been reported to have issues and complications in the hospital. And many of these high-level executive directors have said that their data is 5 years old. And they put this data in a cohort. And right now, even though the data is 5 years old, they're still working through 2018 data. So as we know from this hearing, the hospital system is working on 5-year-old data where they're supposed to be helping Black and brown women through a very difficult time in their lives. And it's sometimes a matter of life or death. So the hospitals now have a lot of implicit and explicit biases that we have to navigate. So they are lacking funding, they're lacking information, education, and advocacy. And because of this, and from one of the testimonies that we have heard, and so this conversation I want to dedicate tonight in honor of Amber Isaac. So we are here tonight to educate Black and brown women so that we can be more aware, so we can be more prepared, so we can reject biases, reject care and opinions from providers that clearly does not make sense and is not in our best interest for our lives and the lives of our children. So we are here. So Amber, thank you. Thank you to her family, and thank you to the countless women who have given their lives to birth beautiful children into this world without having the best of care. So tonight, without the betterment of our healthcare system, we are going to educate. So starting out with a very tough question, and one that many of my friends and family members have had a difficult time navigating, I would like for you two, as experts, to talk about lactation and breastfeeding. I have a number of questions about this, But for the people who don't really know or may not use the term lactation, but may use the term breastfeeding, it is interchangeable with each other. So for the women that are struggling with lactation, maybe I can direct this question to Thamar. How can women increase their ability to lactate? And what should they be eating to maybe help this this issue that that is occurring?
You can hear me.
Now I can.
Okay. So so it starts with education. Everything starts with education. It really grinds my gears when people go and try to breastfeed without any conversation to have wanted to do that before the baby comes out, right? We have to stop thinking breastfeeding is instinctual, right? Breastfeeding is natural. Breastfeeding is something that people have been doing since the beginning of time. But what happened is we live in a modern society, and the generation before ours kind of lost it, you know, and especially when it comes to like immigrants and stuff like that, like we lost that kind of, like our families didn't really do it, or our families didn't do it really well. So we lost that education and we lost the familial part of it, right? So it's up to people like myself to teach others how to breastfeed, because babies are instinctual. They will breastfeed 9 times out of 10, but it's just like it has to be taught again. So you have to take a breastfeeding class. You have to hire a doula with breastfeeding experience. You have to get us IBCLC if there's like real issues with breastfeeding for you. So understanding and being okay with getting help, like the same way and I hate to say this, but like the same way we pour money into baby showers and you know, getting the coolest baby pregnancy gadgets, is the same way that we need to pour in and invest in hiring people to help support us when it comes to pregnancy and breastfeeding, right? The conversation around food, like as a CLC, like I can't really. So I'll say, like, as a professional, no food is gonna make you get more milk. What's gonna make you in that you just have to eat well. You have to eat a variety of food so that the quality of your breast milk is better. Nutrition is better than eating oatmeal or eating I don't know what else people eat, but like whatever you eat, it doesn't matter. It's for the, like, scientifically speaking, it's a mind game, right? But yes, those things do help, but it helps that you had a lifestyle already, that you were already eating all of these things and continue to eat healthy, because you do need, because breastfeeding, you burn a lot of calories. So refilling yourself up and eating more will help, right? As a Haitian woman, yes, eat the legume, eat the oatmeal, you know, drink all the teas. Those things do help. But again, it's more about knowing your body, understanding that we come from a culture that believes in these things, and that it's okay to continue it into your lifestyle in your home. But knowing that the only way you're going to get more milk is to breastfeed your baby. The more you breastfeed, the more milk you make. The more you breastfeed, the more milk you make. That's it.
Oh, because I was gonna say my mom gave my sister just a plethora of stuff to try. Teas,
Listen,
all these things.
I had it all.
I'm guilty too.
I did not have a problem with milk.
I had the teas. I tried, which, I mean, I found a tea. You know, and I'm not gonna say here because, you know, Tom was like, so, but I found a tea that was working.
I know.
I steeped it, and I also made it into like a lemonade because I like cold things. So instead of making it hot, I made it into like an ice, you know, iced tea
around when you did
instead.
that, because you would have got in trouble.
I know. No, she wasn't around. Yeah, I mean, I saw the cookies, you know, the oatmeal cookies, saw the YouTube recipes on how to make the, you know, lactation cookies, saw them in the store. I mean, I never bought those, but yeah, I did look into things like the cluster pumping, all of that. I mean, I'm very fortunate that I did have a good supply. I was able to stock up, even before, to go back to work. But by the time I went back to work, because of the stressful nature of my job, I wasn't pumping as much. I didn't have as much time to pump during work. So then, the supply, I was relying on the supply that I had at home, to use that, and that started dwindling down.
Oh, so Nerline was one of those moms that had like the deep freezer and the other freezer with all the breast milk.
I did not have the deep freezer, but definitely my freezer was like stacked, and I had them, I had them coated. Date, I had, everything, different ounces for breakfast, lunch, everything.
And how old is your oldest?
She's 5.
Okay. So you see, I also feel like now we're in the day of like, and I had my son 10 years ago, all of this information was not there.
Mm-hmm.
This information I was not there for myself. Like I didn't know anything. I did not have a problem with milk supply, but I didn't know everything. So I ended up not breastfeeding for long, actually, because I did not know I existed at the time. I didn't know that I could get all this help. And even when you look this stuff up, it wasn't as much as it is now.
Yeah,
so people, if you want to like breastfeed, look up the information. Granted, you're probably going to need help, but from an actual person, but the internet has a lot of information. You just got to do what it says and just do it. That's actually some of it.
Like, I was going to say, to piggyback on Thamar, to say that, now that there is a lot of help, like even, after I gave birth, in my hospital, they made me go to a lactation class, and they had 2 lactation specialists available that can actually come to our room if we were having difficulty.
Right. And
they actually came and took the time to show me how to manually, express the milk as well, and not just use the pump. They showed me actually how to feed the baby at 2 days old. I was able to actually feed her with the cup, with the straw and with the cup. They showed how to, give them the cup, because both of my babies were, had to be under the lights.
Mm-hmm.
So I had to feed them, luckily they were in the room with me, but I had to feed them while they were under the lights at some point. So I was very fortunate. They were very there. They were present and helpful to show me tips and, to help me to get it going.
Mm-hmm.
So I have I have a comment, and then there's a question from the audience. So before I go to the question, so I don't forget, because, my brain. So I was watching this show, A Million Little Things. Oh, yay. Okay. So there was a lady, I forgot her name. I just like binge watched it over the week.
I know what you're talking about.
Okay. So she went into... she just had a baby, and she went into, or I think it was like the day after, and she was trying to leave, and the lactation specialist came in and was stressing her out. You're doing it wrong. You did it, and just like yelling at her. And so it became a stressful environment.
Mm-hmm.
So my question is, can stress be a factor in how lactation comes into play? Like, is that a sole factor, or is it just like a strain more than a stressor?
So yes and no, right? What tends to happen, and I'll build a story for you. So like if that woman from that episode, she was stressed and she had stopped breastfeeding, and she just decided, I'm not going to do this anymore because she's stressed and she's frustrated, and she had just lost her husband and blah, blah, blah. Then yes, that will mess with your milk supply, right? But it's only because you stopped. People all over the world breastfeed, and they continue to breastfeed in the middle of droughts and things like that, and they still have milk. So it's really more of your body will continuously make milk as long as you're feeding it and getting that milk out. The stress play, I think stress plays a role, because I was like very stressed during my postpartum time. And like, like when the Haitians say like, "Ou fait mauvais sang," like stuff like that.
Mm-hmm.
I think that plays a role in it, but it's because you stopped and you did not continue. With breastfeeding, you have to be consistent.
So if you stop, is there a way for you to kind of like go up and down with the feeding? Or if you just stop, it's just like that consistent flow of lactating just kind of
It
slows down.
slows down. Yeah, it definitely slows down. But you know, I always tell people you can get it. It's just that people get discouraged.
Yeah.
You can stop altogether. You just have to put the baby back on the breast.
Yeah, that's what I did. When mine slowed down, when I went back to work, when I would come home, I would put her on the breast directly. And it did, my supply did come, back up, but like Tamar's right, you have to keep it up. You have to keep doing it.
Okay, and then there was a question from the audience. I've heard that peppermint reduces milk production. Is that a myth or fact? I've heard that peppermint.
I've heard that too.
I don't know.
I've heard it too, but I don't know for sure.
I don't know. I don't think so. I don't think so.
I'm trying to think of I'm trying to think like how it works, how the mechanism where that it would cause,
there are herbs to like kind of stop, slow down production, or like if you've breastfed and you want to stop now because for whatever reason, and the best way to stop is just to stop breastfeeding, to be honest with you. So before somebody asks that question, if you want to stop it, more or less. But I don't really know about peppermint. I don't think so.
Is there a way to stop like leakage?
My cousin, I remember seeing her putting cabbage leaves in her bra,
To
help stop it. And again, it's cultural. So, her mom told her to do it. I never found out exactly why that is, but it's possible that there are some things you can do.
No, because they usually use cabbage for to kind of like if their breasts are hard, or if they're swollen, or you're just in a lot of pain. And I'm forgetting the other reason, but I don't think it's more like soothing. And like you would take it right out the fridge, put it on, it's cool. Like that's why people put it on there. Really.
Okay. All right. I guess that was easy. We're gonna go dive in a little bit more. And this is going to just we're getting deeper, right? So seeking maternal health care is extremely difficult. So the more you can do to understand, educate, and build is important. And like I said, sometimes it will just take you doing some type of research. So as you build and as you educate, it's best for you to build a support system for a better you, for a better us, because we're in this together. As we've heard from, the H&H hospital, they're interested in helping us, but not right now. We're on the back burner. So we have to help ourselves. So my question is directed to endometriosis, the topic of endometriosis. So what is it, and can it be reversed? And it's a very touchy topic. I actually had a friend of mine who's from Tanzania, who actually, I worked with her for a few years, and she ended up having endometriosis, and she was pregnant, and it was like really, really bad. And I didn't hear from her for a while because of that. So can it be reversed? What is it? And how do we navigate this condition?
So from my knowledge, in education, endometriosis cannot be reversed. There's really no cure for endometriosis. Endometriosis, it occurs when the endometrial tissue that lines your uterus overgrows, and it could be found on in other places in your body. So it could be on the ovaries, it could be behind the uterus, it could be on top of the uterus. It may even travel to other places like your lungs. There's the treatments for to treat the signs and symptoms of it. But to my knowledge, as far as what the question was, can you reverse it? No, not to my knowledge.
So how can you check or manage this condition? Is it something that just kind of happens over time? And does it have any symptoms?
So the way that they can, like, I guess, diagnose if you have endometriosis, depending on your sign, symptoms that you're having, and you can go to your doctor and explain your symptoms. If you're having like pelvic pain, painful periods, or heavy menstrual bleeding, just some of the symptoms, and you talk to your doctor and explain what you're going through. They would then would do some testing, blood tests. They would also want to do imaging to see if there is growth, tissue growth in different locations. And what they would do is, one of the ways to try to remove those tissues is to go in laparoscopically with a scope so they can see where they are, and then use the tools, with making small incisions, use the tools to go in there to try, to remove those tissues that are growing where they shouldn't be. As far as we're not going to talk about it later on, but we do know that endometriosis can, is a risk factor also for infertility.
Yeah, I mean, endometriosis is really, I feel like they make it a last resort type thing. After you've done all you can, then they want to test for it, because it is done, like you said, laparoscopically, and there's no real cure for it. The only cure is to find a real, not cure, but the closest to it is to find a really great surgeon that can remove all of those lesions. But that doesn't mean that they won't come back. That doesn't mean that you won't get scar tissue. How deep or how much, there's risk to surgery. There are other things that people do, like getting on, because technically endometriosis kind of, I don't want to say that it's not a hormone thing. It's more of a genetics thing. That's how you get it. It's not your fault. You didn't do anything. It's not a lifestyle disease like diabetes or like high blood pressure, but it's something that you can get. It could be dormant, it could not, but if you're gonna get it, you're gonna get it. So things like estrogen plays a role.
Yeah.
Or at least it makes it worse. So one treatment is getting on birth control, where they would try to shut down estrogen, which has risk to it too. So something else we could do is get on a low progestin. So there's estrogen and progesterone. So the progesterone meds, those are better, because those are particularly attacking that, what's causing endometriosis to continue, or the lesions to grow or be more painful. And I think there's other little meds like that. And it's not, your lifestyle can make it better, just in terms of, it's developed more by eating anti-inflammatory foods. So if you want to have less pain, if you want to have, just feel better, you want to get, you want to eat turmeric, you want to have zinc, you want to make sure you have selenium, just all those things that people do for other diets when they have anti-inflammatory diseases.
So the trickiest question for me with this whole condition is, can you still have kids? Can you still?
Yes, there's plenty of people that have endometriosis that go on to have children.
Okay.
It just takes finding the right provider to help you get there. Sometimes it may cause for you to have surgery. It may cause for you to be on birth control for a little while to get rid of that stuff, or changing your lifestyle. That helps. Who talks about it? Thamar Maori, she has endometriosis, and she talked about just changing her eating lifestyle, and that helped her tremendously. And now she has 2 kids.
Oh, I didn't know that.
Yeah. So You
And
can.
I think it took her a while to get diagnosed. She was dealing with these symptoms for years, like pain, just like having to sit on the toilet. That's what relieved her of having her, the pain that she was dealing with. We've been going to different doctors and sharing her symptoms. It took a while for them to, finally diagnose her with endometriosis.
What's up? Yeah, but things like cinnamon, turmeric, all of those things really, really help, or should help.
And some people, some doctors will say, to take pain medication to deal, to help with the pain. But I mean, I agree with, Thamar, like the lifestyle and having more, natural approach, eating the right foods, goes a long way instead of.
That was really cool. I didn't know that. That she suffered with that, and those were her symptoms. Because sometimes, just the conversation that we were having earlier this week, and listening to the hearing from the city council, where a pregnant woman would go through symptoms and just know that I know I'm pregnant, but I also don't feel well. Like something is wrong. Somebody please help me. And you not knowing exactly what's wrong. And you're going to an expert for them to tell you, this is how I can help you, or these symptoms would match this type of condition. And oftentimes you don't get that. The lines are crossed, and the healthcare providers are sometimes saying, okay, all Black women or all brown women are in this box, and so this is what you have, and it may not be that. So like what happened to Amber. So I thought that was really good that you shared that information, because I didn't know that. That's what I think you said Thamar or Tia, one of them was actually suffering with those conditions. So with that condition and those symptoms. So thank you for sharing that. So I just want to encourage and just pause for a second. If anyone on the live stream does have any questions, you can drop your questions in the comment section and we will answer them on the screen. And please remember that if you sign up tonight, hackglobal.org/join, that you will be entered into winning a DoorDash code or a Lyft code. Okay, and you would have to do that before midnight tonight. All right, so if you do have questions, you can drop it in the chat. So now I kind of want to piggyback off of something that Nerline mentioned about endometriosis and it causing infertility. So let's talk about that, because that is like a really big elephant in the room. And a lot of people suffer with fertility and they don't know exactly what's the cause or how, to manage and who to go to and what provider can actually help them with the issue of fertility. So this question is going to be for both of you, if you can help navigate this for our audience. What are some causes of infertility and what providers can help navigate during that difficult time?
Okay, so that's a loaded question. There could be numerous causes to infertility. But first, infertility is, clinical definition is not being able to get pregnant after a year of, unprotected sex, of timing it and, planning it. And, you just have not gotten pregnant. And women that are, 35 years and older, after 6 months of not conceiving, you should, the recommendation is that you should go and speak to your provider, to get assistance and to see what's going on. To get pregnant, it's a process. Pregnancy is the end result of the process of first, an egg has to be released from the ovaries, which is ovulation. And then that egg needs to travel down the fallopian tubes. And then, it gets fertilized by a sperm, travels down the fallopian tube to go down to, to the uterus, for it to implant, right? The embryo implants there and for it to grow. So through all that process, the end result is pregnancy. So if there's anything that interrupts any of those steps, or something goes wrong, that it's not going to result in a pregnancy. And so that's what they're looking at, and to see what may be going on. You were asked, what was the question? You asked him what like signs and symptoms? What causes?
Well, let's back up for a little bit. Is reproductive? Can we couple fertility in reproductive health? Is that like the umbrella?
Yeah.
Okay. So with fertility, right? What provider can you go to help with reproductive health? Is it OBGYN? Is it a urologist? What types of providers can
you would go to a fertility specialist?
Okay.
So it's become, and they're usually OBGYNs and GYNs and doctors that just really focus on fertility. It's become such a wide and such an important tool, department in medicine, that
Right.
hospitals have their own departments for this. Across New York City, there's a lot of them.
I think they're called like reproductive endocrinologists. I think that's one of the official titles for them.
Right, because our endocrine system plays a major role, because that's all hormones and things like that, and that's usually where the problem starts. So yeah, but I mean, your question was so big.
Yeah.
I didn't even remember it.
Because it was a question from last time that we got from part 1, and as well, we had some people just drop questions in my chat box, and they asked me to ask it, because there are a lot of women who they're trying to navigate and figure out how to deal with the fertility issue.
Yeah.
Maybe they miscarried, and then they never were able to get pregnant again, or maybe they had an abortion and now they want to get pregnant, and it's just like a struggle. So they just needed to figure out how to navigate fertility and what specialists to go to.
Right. I mean,
go ahead.
And I was going to say, like I was saying, with that whole cycle, if there's any type of interruption with that, I mean, you need your ovaries, to be functioning properly. So, if you go see, if you've been trying to get pregnant and you haven't gotten pregnant, or there was some complication that caused that you're having trouble conceiving, and it's been a significant amount of time that you've been trying, go to see your doctor so that you can get your ovaries looked at, that you can get your fallopian tubes looked at. There's there's certain things like there may be fluid in your fallopian tubes that could be there could be a blockage in there. And if you have endometriosis, then there might be tissue on the ovaries. Yeah, I think we may touch on this, PCOS, polycystic ovarian syndrome. Did you check the ovaries to see, the health of your eggs? We're born with all the eggs that we're going to have. So, and as we get older, we have less eggs. We have, you got to make sure that the egg that's being released is mature. So, yeah, when you're, when you go see your doctor, or when you're seen, especially, they're going to be checking at all those things. And let's not forget, it may not just be the woman, the man as well may have some issues.
That was my part 2. Yeah. How do you navigate that? So I want you to just talk about the male infertility, and then we'll come back to PCOS.
Okay. So yeah, with both of you, the couple would have to go to, have the conversation and go together to see the doctor. The doctor would do a physical, workup, pelvic exams and everything, do blood work, get family history, had there been issues, health issues on both sides. Maybe he has some health issues. If he had like chemotherapy because of cancer, radiation, that would cause problems with, the sperm cells. And maybe he got injured, down there. That would cause problems with the cells. They may be misshapen. It may be, not the right shape. We know the sperm has the tail. It needs to swim. Maybe it's it's not swimming fast enough. There's a deficiency there. The count, it matters. The amount of sperm when he ejaculates. Some men don't have very low sperm counts, and so they would do testing and figure out all of that to see what's going on. And just because someone is having infertility issues or and not conceiving, it doesn't mean that they won't end up conceiving in the end, because we know, of course, with seeking the doctors and getting help and treatment, changing their diet, changing their lifestyle, it can it can result that that they do end up getting pregnant, or they may have to go and get like in vitro fertilization, or further help.
Which is a whole different conversation. Yeah. We're not even going to touch that. But let's talk about PCOS for a little bit. What is it, and is it something that can be managed? Like a lot of these other conditions that we experience as women of color, 60% of these conditions can be prevented. So is it something that can be prevented?
It's hereditary.
Yeah, I don't think it could be prevented. I think it could be well managed.
Okay.
Yeah, it can be managed, but it's if you get if you get it, you get it. And if you have especially if you have a family history, if you have a mother or a sister that have it or had it, then you're at risk of getting it as well.
Can you tell everyone that's chiming in right now, that's on the live stream, what is it, and what are some symptoms of it?
I mean, PCOS is basically when your body, your reproductive system is not you're not having any ovulation, and you're getting high levels of androgens, which is pretty much male hormones. So you're getting a lot of testosterone and pretty much not enough estrogen, and there's no consistent ovulation occurring.
Yeah. Like Thamar said, it's hormones, and you get irregular menstrual cycles, and because you're getting more progesterone, you may have more facial hair, or more hair, other parts of your body. Acne, that's one of the things that patients that I've had, that's the one of the first things that they were trying to deal with the acne, and they were not finding anything that worked, and that led them down the road to them getting diagnosed with PCOS. Weight gain, especially if you have like health conditions like diabetes, high blood pressure, cardiac disease, or heart disease. These are all could be related to polycystic ovarian syndrome.
Okay. All right. So we are going to shift a little bit. We're going to talk about the babies, the end result, right? The amazing beings that we produce and bring into the world. So sometimes everything doesn't go the way we planned. And, there may be some type of complication or difficulty, or maybe the baby comes early, etc. And so these babies are placed in the NICU. So I just want to give some expectant mothers an idea of what can occur in the NICU and what type of support can they receive.
Okay. Oh, no, that's
right. No, I'll let the nurse go, but okay. So the first thing and the most obvious thing is, let's say, the labor goes fine, the baby comes out, the baby can't breathe, right? And let's say this happens for like just a couple of seconds. They just needed to do a little bit of extra push here and there, nothing serious, but the baby is fine. That little thing that happened causes a reason for the baby not to necessarily go to the NICU, but they take the baby, what is it called? I feel like I haven't been in the hospital all pandemic, so I forget. But like they take the baby to the nursery, and just make sure that the baby's lungs are working fine, which sometimes they could do from the room, right? So that just goes to show you that and if anything happens, they could put the baby into the NICU for a little while, and that could be like 30 minutes to 6 hours to 12 hours to, there's something a little bit more serious with the baby, so we're gonna discharge you and let the baby stay. So like to sit here and talk about all the different things, we'd probably be here all night.
Right.
But more than the first and obvious thing is this baby breathing? Like that is their first and most important thing. They want to make sure that the baby is okay, the baby is alert. And the baby is alert, breathing.
Yeah, it's the app. Yeah, it's the app. I'm trying to think of the APGAR, because that's what is like the scale that they check, see, make sure the baby has certain number to make sure the baby is okay. And if they're below a certain number, it's been a while since I've done maternity or labor.
I feel like 10 is the highest number. My son got
9 is 9, and if the baby is good, then it's to go. But if the baby, if they check the baby's is like spasticity, their turgor, their color, their breathing, and if they're good on the APGAR scale, then okay. But if not, if they're running a little low, they may have them, like Thamar said, in the NICU for a little bit, just so that they can get some extra attention and and care.
It definitely happens like when you have a C-section, because what happens is when a baby is born vaginally, they've been exercising their lungs, and they've been just like that pressure allows them to work their lungs out and stuff like that. So that doesn't happen because in a C-section they just come out. They didn't do much of the work. So for that baby, they have to just kind of like exercise their lungs and things like that, and make sure that they're breathing on their own comfortably and normally. So then they would take that baby to the nursery just to check them out, and that usually takes a couple of hours.
Yeah, and I think you also asked like what can be expected, what the parents would do if they're
what are they allowed to do? Yeah.
I mean, especially now with COVID, there are a lot of restrictions, but they're allowed to pick up the baby as long as the baby, depending on what the needs of the baby are and the health condition of the baby. But they can pick up the baby and touch them. They welcome the body, the touching, the warmth, with the parents and the baby. Watching. You can feed the baby in the NICU. You can change the baby's diaper in the NICU. Now, if depending on the health condition of the baby and if there's any type of restrictions, then the nurses or the staff there would intervene and say, what, let me do that. But definitely, parents are allowed to go in there. In some places, even like the siblings, children are allowed to go in the NICU as well. But not every, you just got to follow the hospital's, protocols. But family can come to visit the baby and spend time with the baby, read to the baby, sing to the baby. Just be there, especially if you can't hold the baby.
This is usually for a baby that's like pretty healthy. But if you're talking about preemies, babies born that need to go to a micro NICU, micro, I forget the word, but like extra preemie, or extra NICU-ish,
special care.
Yeah, you cannot pick them up. You cannot touch them because usually they have a lot of wires. They have a lot of things going on.
Can you put your finger? I see this on the TV. I don't know, but
yes, you can. Yes, you can. You can definitely do that no matter what. But when they're that small, if they were born at 27, 28, 29, 30 weeks, no, you're not picking up the baby. It's really
they're monitored. They want to regulate their body temperature. They want to make sure their breathing is regulated. They want to their heart rate, all of that. So again, depending on their health condition, health condition of the baby.
And babies born. Babies born before 30 weeks, they're not eating. They're being fed through a tube,
which makes it harder to breastfeed or to even try.
Yes and no.
You can still pump.
You could pump because they're going to be fed through the pump, through a tube.
Okay.
So what they're putting in there is your breast milk essentially. And hospitals are actually really good with helping moms, supporting moms when that situation occurs. From like the leaflets that they give you to, you know, you being able to pump while you are there to visit the baby. You could stay all day with the baby. Because of COVID and before COVID, there was the vaccine. You had to make sure that you, y'all don't remember? It was like right before what was it? Like the what are those vaccines? No, you had to make sure you got it. We, like, most people have it, but you gotta remember the big situation.
Measles?
Yes, measles. The measles.
Yeah.
Right. So like I had a client during the measles outbreak, and the baby was in the NICU, and like they weren't letting people into NICU. Pretty much only the parents. The parents had to either get the measles vaccine, or they had to show proof of it. They were only allowed to have one person for the duration. So if your baby was in there for 3 months, that's it. Like this is the only person. We can't go back signing in someone else and someone else. Like other people couldn't visit and things like that. So there can be restrictions, and I'm kind of okay with that because these babies are fragile. They could get sick. They could get infections. Yes. So yeah. I mean,
it's not to. I mean, I know when I worked, worked with the babies. It's like it's not that we want to keep the family away, but they cannot save themselves. They get something happens. They can't. Their immune system is not fully working. So you have to take a lot of precaution. With anyone going to be in there. And sometimes it's not just one baby that's in there, it's multiple babies.
So, and are you allowed to, I guess depending on the level of the NICU, are you allowed to sleep there like overnight? I know you can stay there through the night, but are you allowed to actually
in the NICU?
Yeah, or do they have a special place for parents or moms to stay in the hospital if they want to leave?
No.
What?
No, not at all. Go home. So here's the thing. If the mom hasn't been discharged yet, well, yes, the mom will be there overnight. There are places like they have like breastfeeding rooms, rest areas, but they don't have anywhere for you to be overnight. You go home and come back in the morning.
Come back. It's a lot of trips. It's a lot, depending on how long the baby's in the NICU, it's a lot of trips.
But there is a lot of support outside of the outside of the hospital, like different organizations and things like that for moms of parents of preemies to just like support you in that.
In a perfect world, we wouldn't want to think about NICU, so but just in case.
It's very real.
Yeah. All right, so we have 2 more topics, but before we continue, I just want to pause for a second. As a moderator, I just want to, and I was reminded just to make sure that if you have any questions related to navigating pregnancy, whether it's preparing, postpartum, or during pregnancy, you can drop your questions in the comment section or the chat box, and we will answer it on screen before we end the live stream tonight. All right, so final 2 topics. Let's start with this one since we're talking about NICU, postpartum care. We started talking about it last time, but we did not get to continue. So I know Thamar started talking about a lot of organizations that have resources that can help mothers post, childbirth. So is this the same case with postpartum? And what are some things that we can do as new moms for managing postpartum care?
So the U.S. healthcare system sucks in terms of postpartum care for women. And I stand by that, right? Because I gave birth, and I'm sure you did too, Nerline. You gave birth and you went home. Nobody called you. Nobody checked in on you. Nobody came to see you. And you have your 6-week appointment. I think the first time I realized that I wanted to, the second time I think the seed was planted in me that I was going to do this work was I met this woman at my old job, and she was like, she had a heart attack a few days after she gave birth. She was very stressed. She had a lot going on. She already had a baby. This was her second one. And, according to her, she just got a second chance at life, but that shouldn't have happened. Yes, things happen, and things happen for any type of reason. But if somebody was checking up on her and realized, hey, I see some signs that are things, maybe you should come into the hospital so we could monitor you a little bit closer, there you go. But there's not. There's nothing you can do. So midwifery care is different. Home birth midwives, if you give birth, or just like the midwifery model of care is completely different. You give birth, they check on you within 2 days. They're more inclined to just like pick up your call if you call them.
Yeah.
They check on you 2 days, 3 days, a week after for like checking on the baby, and they're pretty much at your disposal. Where in our healthcare system, to be honest with you, we don't have access like that. Like, it's too hard for a doctor that has like 30 people on their roster to kind of cater to you the way that you need to be catered, especially as Black women. So that's really, really hard.
You know what's crazy, Tama? I'm referencing back the can you hear me?
Yeah, I hear you, but I froze, so I don't know where I stopped.
Yeah, you're back in now. But I want to piggyback off of something that you said. So, and something that happened from Monday's testimony. The hospital said that they are in need of long-term investments on the services that they offer women. And they're severely lacking in that area. But they also stated that postpartum services are more in place than they have any prenatal care services in their institution. And yeah, and I kind of re-listened to it. Yeah, I played it back today to listen to it, and I was like,
where?
especially that was the hospitals that were on that call. And it's not to say that like I do feel like you'll find the golden nugget in some rubble. I don't know what the phrase is, but like you'll find some good doctors that will be at your disposal, that will teach you. Another thing that doulas do is teach you about different signs that are reasons why you should reach out to your clinical professional to make sure that you're okay. I don't really know. I don't want to say that like I try to get my clients to like get a provider that I like, but lately I've come across providers that are better at taking care of their patients postpartum, but it's making sure that you yourself have to create that tribe, that clinical team to have your back, for you to kind of lean on, your support, right? So making sure you have a doula, making sure you have a lactation counselor, making sure you have access, and you have this conversation with your provider, whether it be a midwife or OBGYN, that if something happens, I could call you and you could call me back in a few hours and I don't have to wait. Or I could talk to somebody, or you have a midwife fellow or a GYN resident, like somebody that will pay attention to me and know that I have access to. But I don't really see that in hospitals when you have hospital care. And I'm not talking like if you go to a private practice or something like that, because sometimes that tends to be different too.
Yeah. Nerline, did you want to share before we move forward?
I have a lot of thoughts in my mind.
Say it all.
I don't know where to start. I think from what they were trying to say, as far as like they have postpartum care in place, I vaguely remember while I worked in one of the city hospitals that one clinic did have this program where the women that were coming to the prenatal classes.
Mm-hmm.
And then they follow them after they did deliver, that they did have like a nurse to go in and check on them for a couple of weeks.
Okay.
But yeah, and I haven't seen that anywhere else, and I'm not sure if that continued, but it was specifically for that group, and I think it was funded. It was government funded. It was a grant funded program. And I would hope that there are a lot more of those, and that's what they were referred to. I'm hoping that they are more of those, because even if it's not the majority, at least it's doing something. And because those women were part of the underserved population, and they definitely needed it, and they benefited from it. They looked forward to our sessions, and just getting advice and just talking about, even if it was just talking about their baby daddy issues, just having an outlet. And so as you guys were talking, I'm thinking back, well, yeah, there was something like that, and I hope that that is what they mean, and that's continuing, and that it's being expanded.
Right.
Yeah,
I think I've heard the same thing. But
yeah.
but let me ask you, Nerline, when the nurses come into the home, what are they doing?
They're checking, they're checking vital signs, they're checking the mother, they're checking the baby, they're looking at her lochia, they're, asking her about her pain or discomfort. They're looking at the baby's umbilical cord, and, asking about how many diapers, and what diapers the baby's had, how is the baby, eating or and latching. I mean, and different things. They're looking in the home. I remember one nurse made a comment when they came back about the condition of the woman's apartment. And she didn't have much help, but they're looking at the environment, the living environment as well. Yeah, that's pretty much what they're doing. There was one social worker involved to help as far as they needed, resources like helping them with their WIC. They were having issues with that. So, I mean, yeah, they did those types of things during the visits.
Okay.
I mean, yeah, I mean, it's helpful.
And you guys could hear me, because I feel like there's a delay.
I can hear you now.
My one gripe with that is someone gets left out, right? Because we're helping the lower income people. I've worked for moms that, Park Slope moms and Upper West Side moms and the Upper East Side moms. We're missing from that. We don't get that help. The people that are the working class, the middle class, even upper middle class, we're not really getting that support, and we are desperately looking for it, but we don't qualify for it and things like that. So what that reminds me is of how white people or further better off people hire nurses. They hire baby nurses to come in and check in on the baby. And just knowing what's available to you, right? So you can hire a baby nurse, or I forget what else they do, but they do that. You can hire a postpartum doula, which will come in from a day after you give birth, whether it's a hospital birth or birthing center birth, and they'll support you and help you. What we focus on clinically a lot is, checking the lochia, checking vitals, doing all of that, but we're not paying attention to the mother's mental and emotional health. So the doula really, really focuses on that. A doula focuses on making sure you eat. A doula helps strategize who's supporting you, how they're going to support you, just like literally analytically, like day to day, what's going to happen and who's going to be here, whether it's your partner or whatever the situation, just like organizing and taking that charge.
They're putting a whole system into play.
Right.
Yeah.
So is there a way to get more access to doulas?
What do you mean?
I mean, I would, I want to say we get it more affordable. I don't even want to go there. But yeah, just being able to, to act, even if it's just to like some kind of database or reference place where they can actually find more doulas if they're looking for a doula or would like to get more information about a doula?
I think, like I said, I always compare it to when I was giving birth 10 years ago. When you looked up this stuff didn't come up. It wasn't on that first Google page, probably on the 5th, but I never saw it. So like if you Google doulas in Brooklyn or doulas in New York, you're gonna get a list of doulas. For me, I'm not on I don't work with an organization per se. So there's like doula referring agencies, like one is not even coming to me because I don't work with them and I don't want to say like bad stuff. But like there's like like Ancient Song. Ancient Song works on a sliding scale. I have worked for them because that's where I first trained. And they refer you and they take women that can afford to pay. They take women that cannot afford to pay $1, $500, $1,000, $3. Like for me, I won't say how much I charge, but like, you can charge whatever you can pay or whatever you can afford based on like however they do it. You can get a doula that way. And there's plenty of organizations like that throughout the city. I like Manhattan Birth. I am a part of their mentorship. I have been a part of their mentorship program. So like if you go to their website, like I'm on their site and, they won't necessarily refer me, but because I'm there, you'll see me and you'll click on me and email me or whatever. But pretty much it's like the same way you want to look for a shirt, the same way you want to look for a new not a new doctor, but like just like look for a professional that does something that's not necessarily in a book. There's this site called DoulaNet, and you can look for a doula that way. But again, just searching and finding that right one and knowing the right questions to ask. And please don't ask those questions that they ask on Google. When you're looking for a doula, whether it's postpartum or not, just find out if you like them. I think we make it really hard on ourselves. I always say that a doula is a friend, not necessarily your friend, but a friend. So if you could find yourself banging with this person and chilling with this person and cracking jokes with this person and being comfortable enough to be vulnerable around this person, then that might be a good person to have as a doula. But yeah, that's my spiel on doulaness.
So my next question, one more thing about doulas. I want to say, so how do we know that they are credible? Like what kind of what certification?
Referral. So like the certification thing is an iffy topic in the birth world. It's very iffy. But to be honest, it's referral. It's finding someone that you trust, finding someone that you know. And nowadays, people know someone that's had a doula. Everybody knows someone that's had a doula, or if they go follow someone on your Instagram, somebody has mentioned having a doula. Start that way. So yes, some people have certification, like certifying organizations like I first started out with Ancient Song, so I always talk about them. But there are plenty of certifying organizations. Manhattan Birth is a certifying organization, and they have my heart. So just I think if people they don't feel like getting someone, like for me, honestly, if you wouldn't want to work with me because like I'm on my own and I do my business on my own, going to a referral agency, so this doula has accountability and they have someone else to report to in a sense, then that's one way you can look at it too. But we're pretty much most of us are independent, and I think people don't realize that or know that.
Lots of doula info.
I know. I just want everyone to. I think people think that doulas are luxurious. We're not. We're a necessity. We're definitely a necessity.
Ooh, I like that.
Yeah, it's not a luxury. It's a radical act of self-care, and people need to dig into that a little bit more.
So speaking of self-care, I want to jump into the last topic. And again, if anyone has any questions, you can drop it in the chat box and we'll be able to answer it for you. So the betterment of our healthcare system and the services that are offered right now to us, Black and brown women, are on an agenda. And for the hospitals that are closest to our types of communities, we're waiting for people to approve it. We're waiting for these executive directors and these people to approve it, to see us, to understand what we're going through. So many women who go through severe medical emergencies like hysterectomy, death, postnatal causes, etc., 60% of those things could have been prevented. And so I often think of preventative care as self-care, because you're taking the time to make sure that you're preventing a medical emergency or something to happen. There's some things you can control and there's some things you absolutely can't. But I like to think of preventative care as being self-care, taking the time to go out and making sure you're getting checked out for a number of things. So when we hear preventative care, it was taught to us for many years that it's contraception or birth control, right? Like we spoke about at the beginning of this. But as we know it now, and as we're sitting here having this conversation, we know that that's not true. So what types of things are included in preventative care for pregnancy? And I'll direct this to Nerline.
I mean, nourishing your body, like you're pregnant and you're carrying a baby. More now, like you need to be mindful of what you're putting into your body, what you're taking. So nourishing your body, your food. Food is the medicine. Food is medicine that you need, and it's the right medicine. So the right choices can bolster your mood. The right choices and foods that you eat, can deliver the key that you and your baby need, and help your baby to grow and help you to feel better and and be healthier as well. Being active. I've had pregnant patients that were just like sitting around a lot. But you have to be active, have to be moving. It doesn't mean that you have to be doing strenuous activity, but walking, not just sitting down. Swimming is good. I mean, but of course, any type of activity that you want to do, you should definitely consult with your doctor or whoever your provider is to make sure that it's okay. Like if you weren't like an active person before you got pregnant, if you weren't working out, you can't do that now. But not what's it called? Not high intensity, but like low impact, low intensity exercises.
Yeah.
And you can seek the guidance of those around you, or that maybe are healthier and fit, or your provider. Taking time to rest, spacing out things, also keeping, trying to stay as stress-free as possible. But like the preventative or self-care, now is a big thing. Now self-care, take a, mental health days, just, relax. If you can't, like we were talking about last time, if you get like prenatal massage, make sure to go to an expert, but all that's incorporated in self-care, but definitely, especially because you have a growing baby, the food, the things that you're putting into your body, you have to be very mindful and conscious of that.
Yeah. And I think there are a number of things too, medically that can just act as preventative measures, right? Or preventative screenings that we can ask our providers for, just to make sure that we're okay. And a number of these things are covered under insurance, because it wasn't a conversation for us years ago. And now that we have so many instances where people are just developing new conditions, and it's taxing on us mentally and physically. And so I think that now insurance companies and providers are noticing this, and we're able to ask for some things that actually will help us in the long run while we're going through, I like to say, 10 months of pregnancy and post.
Right.
So my only thing with that is that it's not necessarily new diagnoses or new like conditions coming out. What happens is the answer to women's health has always been be on birth control. And what happens, birth control kind of mirrors your period. And what happens is whatever the doctor is trying to get rid of your symptoms, but they're not necessarily figuring out what the cause is. So you'll go on from like high school, because that's when it really starts, right? To like, oh, I'm getting married now, or I'm in a committed relationship and I want to have a baby. That's when you get off the birth control. And you realize, oh snap, I've had this condition, or I have PCOS, or I have endometriosis, or this, that, and the third, or I don't know what a regular period looks like because I've never had one. So then that's when questions become, what do I do? And then we're taking care of ourselves now, which is not the greatest way to do it. And that's only one thing. But there's like a million things that we can do to take care of ourselves. And that's first educating ourselves and finding out the information that's necessary. I think nowadays people are going back, because now we're realizing that, yes, modern medicine can be life-saving, is essential, it's important, but we're going back to our roots and going back to, understanding what our elders taught us and knowing how to, I was reading this article, just like how, and it didn't have to do with breastfeeding, but I think breastfeeding is the easiest way to explain it. Like, breastfeeding is natural, breastfeeding is instinctual, but we don't know how to do it anymore because it got lost a few generations back. Right. So it's the same thing with our bodies. We've become so mechanical, we put all these modern things into our bodies, so our bodies are going to become modern and we don't know how to fix it. So it's really just going back to that place of instinct and knowing our bodies and understanding our bodies. And
the first thing that learn.
Yeah, exactly. Yeah. I mean, shameless plug, but next month, I'll be doing a course just really like for women that are preparing to get pregnant. Because that's another thing. A lot of us act like, I wasn't, not that I wasn't trying to get pregnant, but this pregnancy was such a surprise. You're in a committed relationship. Stop it. If you are actively not trying to get pregnant, then you were definitely going to get pregnant. So I really want to focus on getting to know your body. People don't know what their pelvis don't know what their pelvis does, don't know, what a healthy womb feels like or does, what your cycle should look like.
Yeah.
The fertility awareness method, all of that matters, and we don't know how to do that stuff,
Yeah, like you said, when I was in high school through college, really, for me, preventative care was always birth control, right? They were putting it down our throats, and it's just like there are other things that factor into the umbrella of preventative care. So how do we understand that? And right now, like having this conversation is very helpful to not just for us just sharing this information, but to everyone that's going to watch this like replay, right? And not just on the live stream, because we're so ingrained as a society as to what we're taught, and we hear it the first or second time that's that. And you have to dig deeper sometimes. And I'm really happy that we're having this conversation because it's opening many doors, right? One question opens a door to like 2 or 3 other things. And this is what health education is all about, because all of these things are interconnected, and they play a role in how we make choices in our lives to, navigate whether we want to be pregnant or whether we don't, or whether we want to make sure we don't, have any other types of conditions during this time.
Okay. Yeah. Like you have to prepare your body before you get pregnant. Like you know that, you want to have children someday, you have to take care of your body and you have to prepare it, so that, to be able to bring forth life. This body that we have, this is a temple, and we have to treat it, as such. Not just wait till, yes, I'm ready to have a baby. No, but self-care, nurture it, tender loving care, like put the right things in it, so that you can get great, beautiful things out of it as well.
Mm-hmm. Absolutely. And we have one question in the chat box before we end. Do you think it's okay to see a fertility doctor before trying to have children? Why wait for the issue to see one when you can find out before?
My question to that is, why see a fertility doctor, if you are not having issues with fertility? So if you know that if you have been having trouble conceiving, then you let your doctor know what's been going on, and then they would refer you to a fertility doctor. But that's usually not like the first place you go.
Yeah.
That's usually not the first place you go. But you would just start, trying. If you are, you're ready to, or you want to have a child, then you start trying it. But if you're having difficulty, then you would see, the specialist to see what's going on.
Yeah, I mean, there's a definite way to do this, right? You would have your provider already, which is probably your midwife or your GYN. And then if that midwife or GYN feels that there's a problem, or if there's something else and you need to see a specialist, then that way. But your first step shouldn't be to go see a fertility doctor. Your first step should make an appointment with your medical provider.
Maybe they're just trying to see, like, are they fertile and can they actually have children?
Okay. I would still start with my.
Yeah, your doctor would be able to tell it, but again, it goes to the step, like, if you're having regular periods, your regular provider would be able, to tell you basically if everything is in alignment, everything looks good here, and if there's, of course, when you go to your regular exams, they do pap smears, they do pelvic exams, they, they do a GYN exam where they check, they go in and they, look into your vagina and check so they ask you questions about your family history. So, if there's something that's making you think you should see a fertility doctor, then, there's like a seed that's been planted. But other than that, you can see your provider, and, it's the first step.
Yeah. I would just be mindful, because with that type of mindset, we jump to medicine and things like that, where sometimes I advise women to make lifestyle changes and see if that helps first. Because medicine is important and we need the science. We need all of that, but we want to make sure that if lifestyle at all plays a role in it, that we can fix that first. I think my sister was telling me the other day, she saw on Instagram how fertility doctors sometimes have moms take Mucinex, which I didn't know, to help with getting more fertile. But the more
a cough medicine?
Yes. Right. And what does that do? Right. That takes out congestion.
It's an expectorant. It helps to get rid of mucus. I'm wondering.
Right. So mucus plays, and it's true, right? Mucus does play a role in fertility. But here's the thing. Why not just tell women to stop drinking dairy?
Yeah. So
you know what I mean?
Consuming dairy, yeah.
So it's we're so quick to find solutions, but how about we figure out, like you said earlier, getting preventative care, and making lifestyle changes before.
Right.
It's always about giving medicine. I don't know why. It's always oh, something doesn't work. Here's some medicine. Take this. You got 5 strips.
I'll play devil's advocate a little bit, because I do know one of the. No, I'm just saying one of the.
You have to. It's okay. I get it.
Here goes the nurse who makes the scripts.
No, but one of the first steps is to try to get rid of things that might be in your diet that might be causing,
Right.
this issue. If you're drinking a lot, if you're smoking, certain things that you're eating, the lifestyle that you're living, you want to see that works, and then you go, you're like, it's a step. You go, okay, now I'm gonna go a step further. I'm going to the next thing.
Yeah.
Agreed.
Thanks. That's a good question. Thanks for the question, though. I mean, I guess.
Yeah.
I mean, she's not. I think it was a female that asked us, but I think she's not the first person that I've heard ask this question. Oh, I'm just gonna go see if my husband and I are gonna go see a fertility doctor before we get when we get married. When we want to start having kids. It's like why? Like why? That be your first step?
The type of test that I would do is a genetic test, especially for Black people. My mom has sickle cell, and I have a trait. So making sure that my husband didn't have it.
Gestational diabetes, is that something? Well, I know that's for the child, so it's maybe screening for diabetes. Is that something to do before as well?
Well, you can ask them, just basically ask them, is there anyone in your family that has diabetes? Anyone, mother, father, or cousins, uncles, anyone in your family that's had, diabetes. If you see that there's a line of people of having this, there might be a genetic, correlation there.
Right.
Yeah, but I agree with Thamar that, the genetic test is good. And same story, I know someone that, they didn't do it. They didn't do a genetic test, and they had, started having children, and that's when the second child came out with sickle cell, and they both have the trait.
Mm-hmm.
So that's, if that's something you can, I agree with Thamar, that's a test that I would recommend getting done.
Yeah, but the diabetes thing, gestational diabetes, is just that diabetes that you get when you're pregnant. You can't
that's the one who was talking about gestational. I just heard diabetes. Sorry.
Yeah, no, she said diabetes, but she also said gestational. So that's not tested till about 20 something weeks of your pregnancy.
Okay. Well, ladies,
thanks for the questions.
Yeah, those were all the questions. Before we end, I'm just going to give another opportunity for the people that are tuning in. If you do have any questions while we are winding down on the program, you can drop it at this time. Again, I want to say thank you to our sponsors, Lyft and DoorDash, for sponsoring tonight's episode, our part 2 to navigating pregnancy during a pandemic. We have had amazing panelists who have helped us navigate difficult topics. Thamar Innocent, a certified doula, and Nerline St. Elme, who is a registered nurse, and both who work in women's health. So thank you so much for being with us, and thank you so much for sharing the wealth of knowledge that will help us not just today, but for years to come, because as we know, we're in this super hyper sensitive digital world, and things tend to live in the cloud, right? So we're going to be able to replay this and share this information with many people. And thank you to the people who inspired the topics and the conversation that we had tonight. And thank you to the testimony that we heard from Amber Isaac's fiance earlier this week that really helped us navigate where we wanted to go with this conversation. And so as we are coming to an end, I just want to just check in just to see there are no more questions, but we are getting some thank yous from the people who chimed in. So I just want to give the opportunity for everyone to share their Instagram handles or wherever you want people to follow you. Myself, I'm on Instagram, and you can follow me at thedebbylewis.com. At the Debbie Lewis on Instagram. So if you want to, you can go ahead and follow me there. And I'll let Thamar just kind of give herself. Her name is Thamar, but I call her Thamar. So I'll kind of let her just say thank you, and this is where you can follow her.
Yes, you can follow me at Thamar Innocent. Is right there on the screen. I think you guys could see it. My blog is called Heavenly Nature. My website is called www.theheavenlynature.com. But on Instagram, you can follow me at Thamar Innocent, which is my full name. And no, it was just a pleasure. Please, if you do go on Instagram and go to the link in the bio, you can sign up to be on my email list. That's all.
Thank you. And last but not least,
me.
Yeah, Nerline. No, my sister's name is Nerline, so it just rolls off the tongue for me.
I forgot about that. That's true. She is.
Yeah.
Like I think it's on here as well. My name is Nerline St. Elme. I'm a registered nurse, and you can follow me on Instagram at Life by Neural.
Awesome. Again, thank you, everyone. Have a safe rest of the year. And should you have any questions and you want us to answer it, and you weren't comfortable asking the questions this evening, you can drop it in our inbox and we can answer that question for you, and also direct you to the right providers or the right places where you can get the rest of the information that you need. So thank you so much. And thank you to HACC for allowing us to use this platform to share this information with this community. All right.
Thank you.
Have a good night.
It's a pleasure. Have a good night.
Bye.